Dr. Conti, can you tell us a little bit about how you got here?
Sure. So I'm a native of Washington, D.C., grew up in Bethesda, Maryland, and went to Howard University, and I was a zoology major. Medicine was not on my radar at all. I was going to get my graduate degree at some level and continue to work at the Smithsonian, where I was doing a lot of my internship opportunities in the summer. I was at the Smithsonian Tropical Research Institute in Panama, and kind of was loving life, and met a lead investigator there who had his PhD but also was a medical doctor. And one day he asked if I wanted to spend time with him in his clinic in Panama City. And in my mind, I thought he was talking about a veterinary clinic. And when I got there, I didn't see any animals, and I was wondering where all the animals were. And he said, "No, this is my medicine clinic." But I was really at that moment, just really taken by the fact that these people were coming from all over Panama to have access to a doctor. And it was really kind of amazing. I mean, I do have one physician in my family who's a surgeon, but no other physicians. So, then I had to make this big turn. Instead of studying for the GMAT or the GRE for grad school, I had to start to prepare for the MCAT, and then ended up going to the University of Maryland for medical school. And even there, I wasn't quite sure what I wanted to do. I knew I liked kind of generalist care, so I liked both emergency medicine and family practice. And in that residency matching program where you decide where you're going to train and where these training programs decide who they want, I had actually listed both family medicine and emergency medicine programs and matched in emergency medicine. We moved to Pittsburgh after residency. My wife is a family physician also, and who grew up here in the Pittsburgh area, and we've been here since 2001, where I've been practicing largely emergency medicine, some sports health, and concussion medicine. But about 3 years ago, I took a break from emergency medicine and was a chief medical officer at a federally qualified health center, which is a primary care center that provides care in underserved communities, and noticed just how broken the primary healthcare system was. Even a government subsidized system was very broken, and you were driven by the clock on the wall, not by the quality of care. So after about 1.5 years, I kind of made my way back to emergency medicine. But during this pandemic, my kids were here at Athletic Republic for a little kind of meet and greet for their soccer team. And as I'm sitting in the lobby, I'm looking around and I'm just amazed at this practice. And I see a station where there's a gourmet kitchen, and I see a health coach sign, and I see a pharmacy, and I see a clinic. And I was just really quite amazed by that. And I'm thinking to myself, this would be a cool place to work. And so as luck would have it, Betty and the folks here were looking to do some growing. And it's really wonderful that they felt that I would be a good fit for this place. So, so here I still do provide primary care, but I also am trying to grow our service lines as it relates to sports health and concussion medicine. Like Dr. Wolf, I can also see children and feel comfortable managing basically birth to age 100 or beyond. So it's really great to be here, just because there's this wealth of knowledge. Dr. DeMarco and Dr. Wolf and I spend time really just kind of learning. We're getting lectures now from Dr. DeMarco because he was just at an annual conference, and just learning, again, as Dr. Wolf said, being lifelong learners is what you want in your physician team. And I think you get that here. The only other thing I'll say is that really is significant to me is the fact that our environment really breeds that partnership that's required to achieve health goals. You don't see clocks on the wall in the exam rooms, and you'll never get an answering service in this practice. You'll speak directly to a provider, most likely your assigned provider, But in the event that they are out of the country or some other way incapacitated, you're going to speak to a doctor. You're not going to have a go-between between your now need and talking to the physician. So I think that my hope is that people will realize that this is, just as Dr. Wolf said, the way medicine was always intended to be practiced, and I'm excited to be a part of it.